We do have the Minister of Health, Ghana's Minister of Health, Sherry Arite. She's on the line to talk us through reforms in Ghana's healthcare sector. Thank you so much, Minister, for joining us. So like I did mention in the intro earlier, a lot of people calling for reforms in the health insurance scheme. Many are suggesting that it's a little too social, that it should be a little more progressive in terms of getting the private sector to fund it. I want to get your thoughts about how you're looking to revamp the healthcare insurance scheme in Ghana.
Good morning. Thank you so much. I think it's not true that the insurance scheme has been neglected. You know, Ghana is one of the few countries that we contribute 2.5% of VAT towards national insurance. And in addition to that, there are other resources for national insurance contribution.
Yes, Minister, I get your point. I get your point about and we'll get, of course, into more of the details of the extent to which the government is involved. But the point I was trying to make is that a lot of people are saying that it should be left to the private sector to fund, that it's not sustainable to get the government to fund it long term.
I don't agree with you. It's sustainable. I mean, other countries are doing it. Here in Ghana, there are private firms that are also doing supporting insurance schemes. So I think the people have a choice. You know, there are quite, I know 2 or 3 private sector, insurance companies that are offering, health coverage. So you can choose to join the government one, or you can go to the private sector. But then the government is aimed at making sure that all vulnerable groups, at least can have access to Medicaid.
All right, so I do agree that Ghana clearly has been one of those among the countries that have agreed to set aside about at least 15% of their budget to the healthcare sector. Ghana is perhaps one of those that has performed the best. But then again, the big question is, how effective is this going forward? Can you just talk us through how it is working out right now?
Well, at least for every program, the teething problems. Even in the UK, they have been doing national insurance for many years. But every year, there's a review of the program to make it better. So this is exactly what we are doing in Ghana. We started this program 10 years ago. So now we are doing a reviewing it to inject more, capacity building into the program.
Right. Let's talk a bit about how you're getting investors into healthcare services into Ghana. Can you just talk us through that very briefly? My time is far spent.
Well, for us, we have 2 key programs, accessibility and then prevention. And then we are also, accelerating the malaria program. We are accelerating programs like tuberculosis. And now we also are supporting the HIV patients with free medication. And with accessibility, we are making sure that we extend health service to vulnerable communities.
Right.
The government is putting in more money on prevention and public health.
All right.